Imagine this. It's late at night. Your dog is lying on the living room floor, and instead of that slow, steady rise and fall of their belly, you notice something different. Their sides are moving faster. Their breathing sounds heavier. And a small voice in your head whispers, "Is that normal?" I know exactly how unsettling that moment is. You Google it at 11 p.m. You watch your dog's chest for 10 straight minutes, counting, second-guessing yourself. Maybe you've already spent $80 on an emergency vet visit that turned out to be nothing, or worse. You waited, and it turned out to be something. And here's the hard part. Breathing changes don't always come with a dramatic collapse. Sometimes they're quiet. Sometimes they build for weeks before anyone notices. But what if I told you that most dog owners are looking for the wrong thing entirely? What if the real warning sign isn't loud panting or obvious wheezing, but something so subtle you could watch it happen and still miss it? Today, I'm going to show you exactly 5 signs that tell you your dog's breathing has changed in a way that matters, and one simple technique you can do at home right now that most owners have never even heard of. Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be, using clear, vet-approved knowledge you can actually use at home. Before we dive in, drop the guilt. If you're watching this because something felt off and you're not sure if you're overreacting, you are not a bad pet parent. You're not being paranoid. The fact that you're here, paying attention, already puts you ahead of most owners. I actually posted a video on early signs of heart disease in senior dogs, which I'll link at the end, and this one pairs perfectly with it. So today we're doing a complete masterclass on your dog's breathing. Grab a notebook, because I'm about to walk you through 5 signs you need to know, plus a 2-minute at-home check that your vet actually wants you to be doing. Let's get into it. Chapter 1. I want to start with the sign almost nobody checks, because it happens before anything looks visibly wrong. It's not a cough. It's not wheezing. It's your dog's resting respiratory rate, literally. How many breaths they take per minute while sound asleep or fully relaxed. Here's the science. A healthy dog at rest breathes somewhere between 10 and 30 times a minute. When the heart starts struggling to keep up, often long before any other symptoms shows, the body compensates by breathing faster, even at rest, even when nothing is happening. Veterinary cardiologists use this number to catch heart problems weeks before a crisis. Here's exactly how to do it. Watch your dog while they're deeply asleep, not just lying down. Count one full rise and fall of the chest as one breath. Count for 15 seconds, then multiply by 4. Do this once a week and jot the number down. Same notebook you grabbed a minute ago works fine. If that number creeps consistently above 30 or jumps noticeably from your usual baseline, that's your cue to call the vet, even if your dog seems totally fine otherwise. Now, here's a quick warning. Don't do this right after exercise, excitement, or on a hot day you'll get a falsely high number. Only counts while truly at rest matter. Chapter 2. And let me guess, you're probably thinking, increased effort just means panting harder. Not that simple. What you're actually looking for is your dog using extra muscles to breathe that a healthy dog wouldn't need. Watch the belly. If you see the stomach pumping in and out dramatically with every breath, or the chest caving in slightly at the ribs on the inhale, that's what vets call increased respiratory effort. It means the lungs or airway are working harder than they should to move air. This can come from fluid around the lungs, airway narrowing, or reduced lung capacity. Stick with me here, because this one is important. A dog working this hard to breathe is not something to monitor overnight and see how it goes. If you see visible belly pumping, flared nostrils with every breath, or the head and neck stretching forward and down while breathing, this needs same-day veterinary attention. Chapter 3 is one I ask owners about constantly because it's easy to write off as a small quirk. Noisy breathing, not barking, not whining. An actual sound coming from the breath itself. This can be a high-pitched wheeze, a harsh honking sound, or a raspy, snoring-like noise, even while your dog is awake and upright. The science here is simple. Normal breathing is silent because air is moving through an open, clear airway. Noise means the airway has narrowed somewhere from swelling, a mass, fluid, or in small breeds, a collapsing trachea. I promise you this is one of the most underreported signs I see in clinic, because owners assume it's just how their dog sounds. If your dog has developed a new breathing sound that wasn't there a month ago, please don't wait for it to go away on its own. Chapter 4 is the one that means drop everything. Gum color. But what if I told you this takes 10 seconds? It could be the single most important check on this entire list. Lift your dog's lip and look at their gums. Healthy gums are a bubblegum pink. Press gently with your finger. The color should return within about 2 seconds. Pale, gray, or bluish gums mean your dog's blood isn't carrying enough oxygen, and that is never something to wait out. This is a genuine emergency, full stop. Now, here's a massive warning. If you ever see blue or gray gums alongside labored breathing, do not wait. Do not search symptoms online. Get to an emergency vet immediately. Every minute counts here. Chapter 5, and this is the one owners misread the most: restlessness and reluctance to lie down. Most people assume a dog pacing at night or refusing to settle in their bed is anxiety or discomfort from joint pain. But when it's paired with breathing changes, this is actually the body's way of finding a position that makes breathing easier. Dogs with fluid buildup around the heart or lungs often can't get comfortable lying on their side because it puts pressure on their chest. Watch for a dog who keeps standing up, circling, or prefers sitting upright with elbows out rather than curling up like usual. On its own, restlessness can mean a dozen harmless things. Paired with any of the 4 signs I just walked through, it moves from curious to concerning. Now, please listen closely, because this is a massive veterinary warning. None of what I've described today is something to treat at home. There is no tea, no compress, no supplement that fixes a breathing problem. These 5 signs exist for one purpose only: to help you recognize early enough that you get your dog to a vet before a slow problem becomes an emergency. If you ever see open-mouth breathing in a dog that doesn't normally pant, breathing that doesn't slow down after rest, or any collapse or fainting, that is not a let's watch it overnight situation. That is an emergency vet tonight. Here is the golden rule, and it's wonderfully simple. You do not need to do all of this constantly. Once a week, count your dog's resting respiratory rate while they sleep, and jot down the number. Once a month, or anytime something feels different, do the 10-second gum check. As needed, meaning anytime you notice labored breathing, new noise, or restlessness. Run through all 5 signs together before deciding whether it's a monitor-at-home situation or a call-now situation. The whole weekly check takes about 2 minutes. Breathing changes are one of the quietest, most easily missed parts of caring for a dog, especially as they get older. But by choosing to learn these 5 signs, by choosing to spend 2 minutes a week actually watching your dog breathe instead of just hoping everything's fine, you are doing something most pet parents never think to do. That is not overreacting. That is exactly what a great pet parent looks like. If this video gave you a clearer sense of what to watch for, please hit that like button. It helps more pet parents find this information before they need it in an emergency. Subscribe and hit the bell so you never miss our weekly deep dives. Leave a comment telling me, has your dog ever had a breathing scare? And what did you notice first? I read every single one. Give your sweet, beautiful dog a gentle scratch behind the ears for Dr. Marcus tonight. We'll see you in the next one.